Protect your DNA. BioPQQ can promote formation of new mitochondria. Infowarsstore.com.
My guest today is Brandy Vaughan. She is a former pharmaceutical sales rep. She's also the founder of the Council for Vaccine Safety, and she's also a mother to a very happy and healthy and unvaccinated 4-year-old boy. So Brandy, welcome to the show. Now, you've worked in the industry. What was it that really kind of opened your eyes to make you an outspoken opponent of mandatory vaccinations?
Well, originally I worked for Merck selling Vioxx. So that was the first incidents where I was exposed to really what's going on behind the scenes in the healthcare industry in the US, and really opened my eyes to what we're being told is not actually always the truth. It's what they want us to hear and what they want us to think. So that experience really opened my eyes. And then I went to Europe for 8 years and I saw how other countries do things very, very differently. And then I came back with my 6-month-old son, who was unvaccinated at the time or now as well, and was bullied in a doctor's office. So that started my research 4 years ago into vaccines, and I've learned really, really a lot more than most people have researched. And I got involved with this in SB 277, which is the first mandatory vaccination for education law in California that was passed back in June, and that's when I really started to stand up and speak out against mandatory vaccination and what's really driving the push for mandatory vaccinations, which is clearly profit and not public health.
Right. So you think that is the truth behind this push, SB 277 and elsewhere. We've already kind of reported on some of the financial ties that Senator Pan had there with the industry, but that's the truth?
Yes. There was a lot of money filtered down into Democrats starting in 2008 when Obama became president. And this plan to start the whole mandatory vaccination push, those bills were waiting in the wings. And there were precedent bills like AB 2109 in California as well. And one of the things that I think is most important, there are so much that I want to say, but a lot of people who don't have children think, oh, well, mandatory vaccinations for education, that's not something that really concerns me. And one thing I really think people need to understand is that this is just the first step. They actually have bills at a federal level and programs to immunize adult population as well. It's called the National Adult Immunization Plan, and it's 136 vaccine doses over the course of a lifetime, not including annual flu shot. So I really think that a lot of people have kind of turned a blind eye. Well, I don't have kids, or my kids are older. This doesn't affect me. I'm not going to get involved. And what we really need to be saying is like, wow, we are giving up our medical rights right now. And first it's going to be the children, and next it's going to be us. And they're looking to implement it through Obamacare, as well as through health insurance. Through employers. So that is one of the things about SB 277 that I really want to make clear. It's not just about the children. And another thing I want to make clear is that the vaccine schedule in the US these days is nothing like when I was vaccinated in the 80s or previous times. The schedule has just increased substantially since pharmaceutical companies no longer have liability for injuries or deaths related to vaccines. And we have 53 coming out in February 2016. The CDC recommended schedule will be 53 vaccine doses before school, which is age 5. And this is 2 to 3 times higher than any other developed country. And yet what we're seeing in the US is, despite spending more on healthcare per capita, we have the sickest generation of children. We have the highest rates of infant mortality we have in the developed world. We have the highest rates of SIDS, highest rates of autoimmune disease, leukemia, childhood type 1 diabetes, food allergies, asthma, autism, developmental delays, ADHD. And instead of mandating vaccines, we really need to take a step back and say, why are our children so sick? And, we're not seeing these epidemics of infectious disease happen in countries that do not have a schedule like ours. So this scare tactics that, oh, these diseases are going to come back, diseases that most of us, my age at least, had as children, chickenpox, measles, that are meant to build the immune system for things further down the line. We're not seeing these humongous epidemics of infectious disease in other countries that don't have such an intense schedule. What we do have an epidemic in the US is with our children's health. We have a generation of children that is sicker than their parents for the first time ever. And that is what we need to step back and say, wait a minute, what's going on here? What's really driving mandatory vaccinations? And if you look at the profit margins, vaccines have a higher profit margin than pharmaceutical drugs because they don't undergo the same safety testing. So the rigorous gold standard safety testing and the years to market that normal pharmaceutical drugs go through, vaccines do not go through the same process. And plus, you couple that with the fact that there's no liability. So the vaccines are the only product in the US you cannot sue for if you're injured. So it has complete federal blanket liability protection. So you put those two together and you have a very broken vaccine system with companies that are making safety studies. They're funding the safety studies for the profit for the products that they sell, and there's no oversight and no regulation. And so we have a very broken system, and it's leading to just an increased overinflated vaccine schedule, and we have really sick children. And there are a lot of studies that are not funded by the companies themselves, independent scientific studies, peer-reviewed by very reputable university professors that show links with the additives in vaccines to these diseases that we're seeing in our population. Aluminum is a known neurotoxin. It's linked with Alzheimer's. It's linked with breast cancer. It's linked with neurotoxicity in vaccine-related doses. Same with formaldehyde is in every single childhood vaccine. It is a known human carcinogen. You can look it up on the FDA. Fetal and animal DNA. Why are these things allowed into the bloodstreams of our bodies and of our children?
Right.
And
well, and you've done extensive research with these vaccinations and as well as the toxins that are included in these vaccinations. And obviously, you know, you're very well spoken about this. You've worked in the industry. So yes, we are seeing record number of sicker children. You know, my nephews were sick the entire time they were going through their vaccine schedule. But there's also this huge demonization campaign out there against parents who might, you know, maybe not even be anti-vax, but maybe they just want to slow down the schedule of vaccinations. But demonization against people such as yourself. Talk to me a little bit about some of the backlash you've faced.
Wow, I've been called a child murderer. I've been told that I should be put in jail, that I should be killed, and actually lynched and burned at the stake, both at the same time. I've been told that my child is disease-ridden. He's the healthiest child of all of his peers. He's off the chart in terms of weight and height. You know, I've been told really, really nasty things. And it's interesting because I think that you have first heard about me because there was some intimidation that I underwent recently for speaking out against SB 277. I was organizing rallies and bringing in doctors and speaking against this myself at multiple rallies and speeches against SB 277 in California. And I received a lot of intimidation, scare tactics. My mail was stolen, my car was broken into, and 2 days after a major rally in Sacramento, the last one I did, my home was broken into.
Wow.
I had a home alarm, which I had installed a month before, based on some of the things that were happening. And they disarmed it wirelessly with my master code, which I had never given out to anyone. They picked my front door very professionally. They were only in my place for 5 minutes. They didn't take anything because then a police report can't be filed if nothing's missing.
Right.
But they did go down the hall. The sensor went off. The dining room window was open and shut for future access because that's actually faces the backyard. And, you know, probably tapped. My phone has been bugged, my computers, my emails, all of that. And
we've actually heard from some other people as well, also outspoken opponents on SB 277 facing this same type of frightening scare tactic out there. We're also hearing about, you know, alternative doctors in the field being suicided mysteriously. Just briefly, we've got about, you know, 1 more minute. Talk to me a little bit about the Council for Vaccine Safety and where people can go for some more information.
Right. So one of the things that I'm doing, I started a nonprofit because once you speak out about this, you're not really employable anywhere else. I started a nonprofit, and I'm dedicating all of my time to doing a public awareness and education campaign, speaking out, doing media and all these things. You can find it at www.councilforvaccinesafety.org. councilforvaccinesafety.org. And on there, you can learn more about what I've been doing and what the new projects we're doing in the future.
And how to get involved. Well, thank you so much, Brandy, for speaking out. We really appreciate it. And like you said, it concerns all of us, so we appreciate it.
Thank you so much for having me.
In the past decade, we have witnessed unparalleled scientific discoveries in the area of health. But no one has put together a formula that focuses directly on brain health, nerve growth factors, and optimizing your cellular energy at the same time. DNA Force is one of the most expensive formulas to produce. Some of the ingredients in DNA Force are $12,000 a kilogram. We are using the coveted, patented, only American source of PQQ, CoQ10, and more. You want the best that's out there at the lowest price anywhere? Well, we're bringing you a total win-win. The ultimate value, cutting-edge, trailblazing game changer that also supports the Infowar. We have produced a limited run of DNA Force, and it will take up to 12 weeks to produce more once we sell out. Secure your DNA Force today at InfoWarsLife.com or call toll-free 888-253-3139. DNA Force,